Hi, I'm Dr. Ravi Goldstein. I'm a physician. I'm an infectious disease doctor at Mass General Hospital, and I'm running to be the next representative for Congress in the 8th Congressional District. I got into this race back in November with one saying, which was that I'm in this race to fight for access, equity, and opportunity for every person in every community across the district. I'm hoping to introduce myself to people today and then share with you my values and the way in which I lead in the hospital. For the introduction part, I grew up in a small town in upstate New York. My dad was a dentist and my mom managed the office in the town. What they really ran was a family business. My sister and I would join them after school and on the weekends all summer long. We would watch as they cared for a community, as they invested in their neighbors. And the work that they do inspires me every single day. I came here to Massachusetts 20 years ago to go to college at Tufts University, and I stayed to get my MD and then my PhD before going over to Mass General, where I did my training in internal medicine and then infectious diseases. Throughout it all, I knew that I wanted to do what my parents did. I wanted to care for communities. And in particular, I wanted to care for those people that were most left out from the system. And so I became a primary care doc. I became a doc for folks living with HIV, folks in the LGBTQ community, people affected by substance use. Now, over the past 10 years, I've built a practice that I'm incredibly proud of, where I get to sit one-on-one with patients in the exam room, address the barriers to their care, talk to them about the challenges that they're facing every single day. In that work, I've recognized that the challenges we're all facing are so much larger than what can be dealt with in the exam room. They are challenges that require a new perspective and change at the federal level. Here in Massachusetts, there are still thousands of people that are living without health insurance, but there are even more that are living with food insecurity and housing instability, who can't access a job that pays a living wage, or who can't access a transportation system that works for them. These are the challenges that my patients tell me about every single day that I think require that fresh perspective. In particular, I think in this district, it's time for a fresh perspective on the role of healthcare, one that is grounded in the fundamental truth that healthcare is a human right and not a benefit for people who can pay for it. I think it's time for a fresh perspective on equality, one that firmly asserts the importance of a woman's right to choose, one that will bring justice into our criminal legal system, and one that can understand how race and ethnicity, sexual orientation, and gender identity all compound in so many different ways to impact someone's access to education and housing, to financial security, certainly to healthcare. And I think fundamentally, it's time for a fresh perspective on the role of government itself, one that is not afraid of bold leadership and structural change to address the enormous challenges that we're all facing together. Things like climate change and gun violence, racial injustice, and certainly the COVID-19 pandemic. I got into this race because I think this district deserves a representative that shares its values and isn't afraid to lead with those values every single day in Washington. I want to share one more piece about my background with you, and that's my work in the hospital. I'm proud of everything that I get to do, but I'm especially proud of what I've been able to do with the LGBTQ community. I saw as a primary care doc how trans and non-binary folks were facing violence and prejudice and marginalization, and I knew that I had to do something about it. So 5 years ago, I established the Transgender Health Program at Mass General. I now direct the program, and with my colleagues, I'm able to provide high quality, personalized care to a group of people who had been left out of the system for far too long. That work of identifying gaps, building coalitions, and driving solutions forward, that's my work every single day in the hospital, and that's the work I want to do in Washington as well. So thank you for listening. Thank you for taking the time to learn about who I am, what I believe in, and how I lead. I hope that you've learned what you need to learn, and certainly if you want to learn more, come visit our website at robbyforchange.com. And I hope that you'll vote for me on September 1st, on or before September 1st, for the Democratic primary here in the 8th Congressional District. Thanks.